I'm sorry, we have Representative Bell. I believe you're the last one on the list. Yes, sir.
Madam Chair, thank you for the opportunity to come back in with you. I really appreciate it. I did have one question I think I want to direct to Dr. Allison and Mr. Ingram. Two hypotheticals. 56-year-old male, 92% FPL, previously existing private insurance policy, self-pay, has gone into private option, I assume would be deemed medically frail given existing cancer condition. If the private option goes away, do we have any options for providing that person with coverage? Second hypothetical, 50-year-old white female, diabetic, covered under Arkansas Health Networks, insulin dependent. If private option goes away, what coverage options are on the table for that person, given the lay of the land, assuming the private option is defunded?
I'll take the first crack at it. I think that's really why I appreciate the question. So the 56-year-old male, to my knowledge, has no option. Below poverty, 92% federal poverty level. The condition that you described, which is cancer, it would depend on the stage, I suppose, whether he might be able to apply for Social Security disability and begin the path towards full disability, for example. I'm not sure how likely that is. It usually is a time-consuming process, but I'll defer on how likely it is they could instead decide that they are fully dependent on the state through disability. A similar situation with the 50-year-old female, depending on how advanced the diabetes is, the insulin dependence. Again, her current coverage is through, or had been through AR Health Networks, and the only option I would see for this woman is somehow to demonstrate her inability to work, and therefore to prove to the Social Security Administration that she is disabled. This is precisely the kind of incentive that coverage can help to overcome. Now, you've heard some challenges to just how smooth that marginal income cost is as a person works one more hour, takes a job, etc., and goes potentially about 138% of poverty. But the other story is closer to what you described, maybe not in these two cases, but in cases like them, where the only option someone sees to provide very necessary health care and services is to declare disability and exit the workforce entirely. And that's the kind of circumstance that I'm certainly hoping that coverage can help to overcome. It's not perfect, we're not there yet, but that's the goal.
Perhaps I should clarify just a little bit. Both those are real people that I've had conversations with, and the gentleman has stage 4 cancer. The lady is on an IV pump. So, Mr. Ingram, can you elaborate there for me as well?
Absolutely, I think I need a little clarification from you, because I'm not sure if I heard your first scenario correctly. I jotted down some notes, but I might have misunderstood one of the words you said. So it's a 56-year-old male with stage 4 cancer, and you said that he was previously insured or previously uninsured?
He's previously insured, 92% FPL, and the female actually a little more on her. Her income level is about 110% of FPL, and she is currently employed.
Okay. So under the first scenario which you mentioned, the individual who's below the poverty line but was previously insured, open enrollment is still open, and that person would also be able to qualify for a special enrollment period if the private option would go away, because they would go from simply having no coverage, or simply from having coverage to no coverage, which means they could then go apply for a private policy like they had before. They wouldn't qualify for federal subsidies, but they didn't have federal subsidies before when you said they were privately insured. The second individual you mentioned, you said she's about 110% of the federal poverty level. she would qualify for federal subsidies and cost-sharing reductions in the federal exchange.
Just point out, the cost of those private coverage, I think we've heard already today, over $1,000 a month likely for, very, very high cost per month. You're looking at a dramatically high percentage of that person's total income at 92%.
We've investigated that, and it would literally take all of his income. So, thank you, Madam Chair.
Thank you.